Good morning, Seneca County. It's the beginning of a new week, and we're back to provide you with information from the Seneca County General Health District. I'm Beth Schweitzer. Just as I always do, I'd like to update you on what the situation is here in the county as well as in the state. We do now have 6 confirmed cases of COVID-19. 2 of those 6 cases have been hospitalized, and of course we have the one that is deceased. So a total of 6 cases with those 2 situations. State, we heard yesterday or saw on the Ohio Department of Health website, we now have over 4,000 cases, 4,043. We have 1,104 people who have been hospitalized, and we have 119 deaths. Now there are 77 of our 88 counties that do have confirmed cases, so we are seeing that spread gradually. You know, as I've said from the beginning, things change rapidly. The advice we're given may be slightly different in the next day, and it's been difficult sometimes to keep up with those changes. One of the things that has debated back and forth is the use of masks. So I want to provide you with the information that the Ohio Department of Health as well as the CDC is supplying for the use of face masks. They continue to study the effects of the virus across the United States and how the use of masks affect that. They've done a number of recent studies, and we do know that there's a significant portion of people who are what we call asymptomatic. They have COVID-19, but they are not experiencing the symptoms that we expect, or some are experiencing very mild symptoms. But the virus still could be transmitted if you don't have symptoms, or if you're in that stage right before, or your symptoms are very mild. So that means the virus can spread between people that are interacting, from sneezing or coughing or even talking. So the recommendation is to use cloth coverings when in public, and we have many people who have joined into this fight and are working hard to make face masks. Yesterday I heard the doorbell ring, and I was surprised because no one usually comes to the door. So I opened the door, and standing back at least 6 feet, probably further, was one of my neighbors who had her face mask on. She had left a couple of masks for my husband and myself on the doorstep. So I appreciated that very much. And there are other places where people can receive those masks. It's critical, though, that we emphasize that 6 feet distance. Just because you're wearing the mask does not mean that you should not follow those recommendations we've been giving all along, which I know are repeated over and over, but the fact that you need to remain that 6 feet distance, good hand washing, good cough and sneeze etiquette, and we want you to stay safe even though you have a face mask. You should wear that when you're out in public. That's going to prevent you from transmitting something to someone else. And of course, we're not recommending the use of the N95 mask. This is the mask that I have been fitted with. All of us here at the health department have been fitted with these, as it is necessary if there comes a point where we need to utilize those. So that cloth mask is going to slow the spread of the virus. You should wash those after an outing. You do not want to reuse them over and over. Also, if you would slip them off and you're out and you need to put it back on, be sure you put the same side. You don't want to have this side out and then forget and turn that around and put that against your mouth and nose, because that could transmit the virus. As things change, the Center for Disease Control will provide those additional recommendations regarding appropriate public health measures as they occur. And of course, you can always get good information on the governor and Dr. Amy Acton's press conferences every day at 2 o'clock. I want to remind you that one of the new orders, which was issued last week, is regarding the number of people that are to be in retail stores. Of course, you've heard that we've had a problem with so many people being in the store at a time that it's difficult to keep that 6 foot distance, and there are more people shopping than probably need to. So at 11:59 tonight, the owners of each store are being asked to determine the number of patrons they feel is safe to have in the store at a time. When that number is reached within the store, they will shut the doors. No one else will be allowed to enter until someone leaves. And please, I'm going to ask you again not to overbuy. We still are seeing empty shelves with products that are necessary for us to meet our daily needs. So please, buy just what you need so that others can have those as well. You may have heard this week that this is going to be a big week. And that doesn't necessarily mean that the peak is here in Ohio or in Seneca County. Because our governor and our director of health have been so proactive, we feel that the spread has slowed down here. So it's important to keep following those measures. Other parts of the United States may be experiencing that peak, and we can't tell you exactly when we will be experiencing that, but we want to be proactive. And so we are following closely the progression of spread of infections in Ohio, and feel that the progression in the counties hopefully is being slowed as well. I've had questions about the number of beds we have and ventilators we have, and will that be enough? I can tell you that the hospitals have been working hard to make sure that they do have enough beds. Elective surgeries have been canceled. Folks who might spend an extra day or two in the hospital are being released as soon as it's safe for them to be released, so they are making those plans to have enough beds available. We have had so many questions about essential businesses, and I know that it's hard to understand sometimes just why a business is essential. And I just, in the last half hour, spoke with the CEO of one of our companies that we've received concerns about. After talking with him, I knew that the business was essential as I looked at the order that talks about suppliers for the types of businesses and operations that are essential. And so I got even more detailed information, and they are operating as an essential business. They will be able to continue to do the measures they need to do to keep the production of things that are needed for our basic living needs, so that those will continue to be supplied. Remember that the ultimate goal of these orders are to prevent the spread of COVID-19. Everything is being done that can be done, and new measures may arise. I know that this is hard, and it's harder for some people than it is for others. I wish that there were a way to prevent that. There are resources out there if you're out of work that you can apply for unemployment. It's difficult to get through on those lines because there are so many people, but be persistent and keep the faith and the hope that this is going to end eventually, and we hopefully will return to a point in our lives that we consider normal, maybe a new, different normal. Unfortunately, we were going to try a new process with Facebook podcast. We were going to bring in Mircha Handru from Mental Health and Recovery Services of Seneca, Sandusky, and Wyandotte counties. Our technological measures, unfortunately, did not work. And this is one thing I've been wanting to talk to you about. I don't have information with me today, but I am going to share, I believe Wednesday, I will pull some of those resources together. I know this is a stressful time. Take care of yourself. There's many different locations. You can go to Mental Health and Recovery Services website. We will post some things on our website as well. CDC and the Ohio Department of Health have good information on reducing stress and mental health issues that may occur during this time. I guess I would encourage you, if you need some extra assistance in mental health, there is no shame in asking for that. Please don't hesitate. This is so important, and I know unfortunately sometimes in our world there's still that stigma. There should not be. So I want you to, if you need to reach out to someone and get that help, please don't hesitate. We will look at the questions you may have online. We're trying to answer those as best we can, so we will keep that information on our website. So hang in there, take care of yourselves, and we will see you again on Wednesday. Thank you so much. I appreciate you tuning in.